First thing I'm going to do is gather my supplies. I'm going to make sure I have my stethoscope. I'm going to have my pen light. I'm going to make sure I have the patient that I'm going to be going to see. I'm going to approach the room, knock on the door. Good morning. How are you?
I'm well. How are you?
My name's Teddy. I'm a TCC nursing student. I'm here to do a head-to-toe assessment, if that's okay.
That's okay.
Okay, great. You go ahead and provide privacy. I'm going to go ahead and do hand hygiene, 20 seconds. I'm going to then don gloves. Says, can I see your wrist bracelet?
Sure.
Go ahead and verify your name and date of birth for me.
Lauren Wright, 11/10/90.
Okay, everything checks out on there. While I'm here, I'm going to go ahead and assess the allergies. Do you have any allergies?
I don't.
Okay. What about allergies to latex or tape or adhesive?
Nope, that's all fine.
Okay, thank you. All right, everything checks out. We're good to go on that. We're going to do the head-to-toe assessment. First thing I'm going to do is when I look at her, I'm going to assess the symmetry of the head, making sure everything looks clean, the hygiene's good, it looks well kept. I can tell that she's oriented as far as like her focus on me, the eye contact, her motion matches her voice. Can you tell me where you are today?
Sure, I'm in the hospital.
Okay, and what are we doing today?
Head-to-toe assessment.
Okay, so she's alert and oriented ×4. She knew her name, her date of birth, where she was, and what she's doing. So we've established that. I'm not seeing any sagging of the face or anything that might indicate stroke or anything like that. So we're going to go ahead and proceed with the head-to-toe assessment. Typically in a head-to-toe, I would start literally at the top. For the sake of this video, we're going to go ahead and go straight to the eyes. So the first thing we're going to do with the eyes is we're going to utilize a pen light. I need you to look straight forward, okay? So you can focus on my finger.
Okay.
Just don't move your head. And I'm going to shine a light in one eye, but I'm going to be watching both eyes. Okay. Okay. And then the last thing I'm going to do is I'm going to take my pen light and I'm just going to go forward, just focus on the pen light. Okay. Pupils are even, round, reactive to light, and they accommodate. So everything looks good as far as that's concerned. The next thing I'm going to do is I'm going to go ahead and take a look at your sclera.
Okay.
So if you give me 1 second, I'll just pull down your eyelids a little bit. Okay. The conjunctiva was pink and moist. The sclera was nice and clear. No yellowing, no discoloring, no edema. Eyes look good. The next thing we want to check out is your nose. If you'll just lean your head back for me real quick, and I'll take a look in there. Okay. Pink and moist, no discoloration, no obstructions, no polyps, and no deviated septum. So everything looks good. Go ahead and give a deep breath in and out. Can you put your finger on one side of your nose and occlude that? Go ahead and breathe in and out. Now do the other side for me. Both sides are even and well articulating. Go ahead and turn your head to the right. I'm going to take a look in your ear. Okay. Ear canal is clear on the left side, on the right side. Go ahead and turn the other way. And it is clear on the left side. I'd be looking for any type of drainage or blockage, any occlusions, any lesions, any rashes, anything like that. The ears look symmetrical. I don't see any signs of swelling. When she was turning her head, I was checking for jugular distension. There was no jugular distension when she was turning her head. Now what I'm going to do is I'm going to have you cover your left ear.
Okay.
And then I'm going to whisper on this side, and you just tell me what I say.
Okay. 0.
Now cover the other one.
Alligator.
Okay, so she passed the whisper test. She has even hearing on both sides. She's able to articulate what she said, what I said. Okay, so we've done the ears, we've done the nose and the eyes. The next thing we're going to do is the mouth. I'm noticing that there's no discoloration. She doesn't have any types of bluish lips, so she's got good coloration, which means her circulation's pretty good. Go ahead and open your mouth for me nice and wide. Go ahead and say ah. Okay. Everything is pink and moist. There's no signs of rashes or any types of lesions. Keep it open for me. Lift your tongue up for me. I'm not seeing anything underneath the tongue. Also with the teeth, they're in good shape. The tongues are in good shape. Nice coloration. Not seeing any cavities. Do you wear any dentures?
No.
Okay. What about any dental work you've had done?
Nothing major. Some fillings here and there.
Okay, great. Now, are you having any difficulties with swallowing or chewing?
No, not yet.
Okay, thank you. So assess the mouth. The mouth seems to be in working order. If there were other things, I would have to follow up with that. Now I'm going to be looking at from down from there, the neck. Everything looks good from the neck, nice proportionalities. Let's go ahead and turn your head all the way to the left, all the way to the right. Look all the way up, look all the way down, and can you shrug your shoulders for me? Okay. Looks like we have a good range of motion for the neck, so everything looks in conjunction there. I'm looking at the breathing. The breathing looks nice and unencumbered, nice and even, good rate of respiration. It's within normal range. So next thing we're going to do is we're going to auscultate the lungs. That's where we're going to listen to different parts of your lung cavity. Is it okay that I touch you with a stethoscope?
Sure.
Okay. Go ahead and sit up for me.
Okay.
I'm going to start by auscultating the lungs. I'm going to start on the upper left side, listening, and then do a zigzag pattern across the front, and then go to the back. Go ahead and take a deep breath for me. Nice. Just keep taking deep breaths.
In a moment, I'll have to work for me, but in this case, it's okay if I look this up, check. And if you don't have any trouble walking, you don't feel any pain, and your muscles aren't sore or anything like that.
And then on the back side.
So I would check
On the back side.
patients by just making sure they're both equal bilaterally, and looking at them, I don't see any lesions or wounds. Patients, I would feel for edema. Okay, patients is good on that. And now I'm gonna go ahead and ask you to lift your leg up.
Thank you very much. You can lean back now.
Okay.
Okay, so the lung sounds were very clear, unencumbered. The breathing was even. There was no signs of crackling or wheezing, so I didn't find any abnormalities. Have you ever smoked before?
No.
Okay. Do you have a history of asthma or any other respiratory problems?
No, nothing like that.
Okay, great. Now we're going to go on to your heart, but before we start, do you have any overall pain in your body?
No, none.
Okay. If the patient were to report some type of pain, I would ask them on a scale of 0 to 10. What about chest pain?
No, I don't think I've ever experienced that.
No history of chest pain or
No,
heart
sir.
disease or heart attack?
None of it.
Okay, excellent. We're going to listen to your heart now. We're going to go through and listen to it, and then once we're done with that, we'll be moving on to the abdomen.
Okay.
First, I'm going to listen to the aortic. Then I'm going to move over to the pulmonic. Then I'm going to move over to the Erb's point. Then the tricuspid. And then the mitral. All the heartbeats are regular and consistent. If I heard any arrhythmias, then I would have to listen to the apical for up to a minute. So no abnormal sounds there. Everything looks good. No history there. So we're going to go ahead and move to the abdomen area. Can you go ahead and lift up your shirt for me, please? And with this, it's going to be very important that we listen to it before we palpate it. So it's very important we do that first so we're not interfering with the action. I'm going to start in the right lower quadrant and then work my way in a horseshoe around. Then the right upper quadrant, the left upper quadrant, and the left lower quadrant. I would normally do this from 20 to 30 seconds. However, if I didn't hear any activity, which I do have normal activity, then I would listen to it for up to 5 minutes to try and figure out if there was activity or hypoactivity or not. Okay, how is your digestion? Have you been having normal bowel movements?
Yeah.
When's the last one you had?
Oh, yesterday.
And how often do you have?
Once a day.
Okay, and so everything's good as far as it's concerned?
Yeah, I think so.
What about your diet? How's your diet?
I try to keep it pretty balanced.
Okay, have you noticed any weight gain or weight loss recently?
No, not recently.
Okay, great. So when I'm assessing this, I'm looking at the skin. The skin looks clean, dry, and intact. There's nice coloration. There's no signs of lesions or rashes. No types of distensions. Now I'm going to go ahead and palpate this region so that we can kind of see what's going on underneath. The first thing I'm going to do when I palpate is I'm going to give it a light palpation. If there's any type of tenderness or pain, please let me know. And then we're going to go through, and if that's good, then we'll do a deeper one so we can kind of get an idea of what's happening underneath
Okay,
that.
I get it.
So just a light palpation in every region.
That's fine so far. No pain.
Okay. Didn't notice any distensions or any types of abnormal swelling or edemas or blood. Now I'm going to do deeper.
Still
I'm not seeing any signs of swelling organs or anything else. Was that painful at all?
good. Not at all, thanks.
Okay, excellent. Now when it comes to the abdominal region, I want to move on to the genitalia area, but in order to do this, I want to be sensitive to both time and the patient. So have you had any history of any type of urinary tract infections or any type of irregularities with your urine?
No.
Okay, and when you have your urine out and discharge, what color is it?
It's usually a very light yellow.
Okay, and have you noticed any irregular odors or smells to it?
No, it's usually pretty clear too.
Okay. All right. So we've assessed urine. Do you have a catheter in?
No.
Okay. So she doesn't have a catheter in. She's not reporting any irregularities with infection or with discharge. So when it comes to this, if we had some issue or we had a catheter, we would go in and inspect the area, making sure we check for infections, redness, swelling, tenderness, lesions, other things like that. Or if the patient self-reports something like an STD, we would go in and assess that region. So the next thing we're going to do now is we're going to do your skeletal muscle. That's like how your body moves.
Sure.
So the first thing I want to do is just your arms, since we're already in bed. So just hold your hands out for me like this. I'm going to check the capillary response in her fingertips, making sure to note whether or not she has any clubbing. She does not have any clubbing, and all of her fingers are well intact. And the capillary response is less than 3 seconds, so she's got good circulation. The next thing I want you to do is hold your hands out like this. I want you to pull against me. Okay, now push against me. Okay, now put your hands out like this. Push in. Okay, pull out. She's got full strength and range of motion as far as her upper extremities are concerned. Let's go ahead and take a look at your legs. Again, I'm assessing all of her extremities, that her skin is clean, dry, and intact. It doesn't have any lesions. The coloration's good. She's got good circulation. There's no rashes or edemas. I'll be testing her capillary response. It's okay. On her toes. Okay, so her toes have a good capillary response, all less than 3 seconds. Okay, so that's good. I'm gonna go ahead and have you lift your feet up against my pressure. No. Flex them. Yeah,
Got it.
flex them. There you go. And now flex them again.
Okay.
Okay, so she's got good strength in there. Next thing I'm gonna do is the dorsal pedialis pulse. Both of them are regular and strong, actually 2+, so very strong. And then I'm gonna do the posterior tibialis. Again, nice and strong, 2+. Gonna go ahead and hand hygiene. Now I'm going to do the radial pulses. Both are even at 2+, nice and strong. Okay, so I'm not seeing any issues with circulations in the extremities. Next thing we're going to do is we're going to go ahead and assess her ability to ambulate. Can you sit up in bed off the side? All right, go ahead and get up and then walk that way and come right back. Have a seat. Her gait is even, her walk is fluid, she has symmetrical. I'd be looking for any evidence of pressure ulcers or anything. Since she's walking and ambulating, I'm able to see the backside a little better so that I can assess the skin integrity, making sure that she's warm and clean and has no lesions. Other than that, I didn't see any tubing, so I didn't see evidence of IVs or anything else. Do you have any type of tubing or IV history recently?
No, not at all.
Okay, so there's no IVs, no G tubes, nothing like that. If there were, I'd be inspecting those for date, cleanliness, and lack of infection to see if it was infected. I believe we have everything we need for our head to toe, and thank you for your time. I'm going to go ahead and hand sanitize and leave.
Thank you.